Hello everyone, welcome back to NCLEX-RN. So today we will dive in Integumentary System. So we will look after the introduction first and then we will proceed further with the next section. So in introduction we will see about the anatomy and physiology of skin. So skin is the largest sensory organ of our body. It functions as the first line of defense against infection. Skin protects underlying tissues and organs from injury. Skin receives stimuli from external environment. It detects touch, pressure, pain, and temperature stimuli, relay information to the nervous system. Skin regulates normal body temperature. It also excretes salts, water, and organic waste. Skin synthesizes vitamin D3, which converts to calcitriol for normal calcium metabolism. And last but not the least, that is the skin stores nutrition. Moving ahead with the layers and epidermal appendages. So skin mainly composed of three layers, that is epidermis, dermis, and hypodermis. Hypodermis is a subcutaneous fat layer which contains fat tissues. So epidermis forms in the epidermal appendages we call as nails. Dermis forms hairs, and hypodermis, that is a subcutaneous fat, composes of glands, that is subcutaneous glands and sweat. Furthermore, the epidermis is the outermost layer. Dermis is the second layer, we can call as a sandwich layer, which is between epidermis and hypodermis. The third layer is the innermost layer, that is hypodermis, that is a subcutaneous fat layer. It is the innermost layer. As age advances, subcutaneous fat is lost, so skin becomes fragile, dry, bruises, and wrinkles occurs. Senile spot are normal in the elderly client. So there are spots like as shown in the picture. Besides, as the person grows older, they get the spots on their skin, the brown color spot, which is called a senile spot, which is totally normal in elderly client. The important thing you need to remember over here is never sterilize the skin. As the skin maintains the normal flora of the body, that is gram positive and gram negative staphylococcus, and pseudomonas bacteria. Also important note to note down over here, that is don't shave the skin, use depilators or clipping to remove the hairs, but never shave the skin. The risk factors that can cause the skin or integumentary problems are: the first one and the biggest risk factor for the skin or the integumentary is the sun rays. So we need to wear the sunscreen lotion, it's SPF 15 and above, to protect ourselves from sun rays. Then second is the different kind of sunlight rays, that are UVA and UVB. The third is the harsh chemicals that we use in our daily lives. The fourth is age and race. The fifth is family history. Sixth is immune conditions such as thematic lupus erythematosus. Seventh is nutrition. Eighth is personal hygiene. Ninth is exposure to radiation, such as if you are a nurse or working in a hospital, you might expose to such radiations while working in the chemo or radiation department. So we need to take care of ourselves during working with those clients. Certain medications that we will discuss in further classes can affect and leads to skin or integumentary problems. Also, the harsh soap, detergent, and cosmetic products that we use in our daily lives directly or indirectly can affect our skin and leads to integumentary problems. There are some psychosocial factors that can affect the integumentary systems, which is change in the body image, decreased general well-being, and decreased self-esteem, due to which we can see social isolation and fear of rejection, which can be because of embarrassment about changes in the skin appearance. Also restrictions in the physical activity, because if an individual is having a skin disease, they might don't like to expose themselves in a public area, right, such as gym. Many of the skin conditions can lead to pain, disruption or loss of employment, cost of medications, hospitalization, and follow-up care, including dressing supplies. So these are all the psychosocial factors that can be affecting the person who is suffering integumentary problem. So now we will go through the wound healing, the process of wound healing. So it mainly occurs in 3 phases: inflammatory phase, fibroblastic phase, and maturation phase. So first, inflammation phase, it is the first and the primary phase, which occurs just after we get the wound or get the injury in the skin. So it begins at the time of the injury and it lasts for 3 to 5 days after the injury. So over here, the symptoms which we can see after getting an injury on our skin within first 5 days, that are local edema, pain, redness, and warmth at the area of the injury. After that, we can see the phase that called fibroblastic phase, which occurs after the inflammatory phase. It begins from the 4th day or the 5th day after the injury and lasts for 2 to 4 weeks. In this stage, we can observe that the site appears like at the base of the injury. We can see the scar tissues and granulation tissues, which comes after the 4th or the 5th day, and it lasts up to 2 to 4 weeks. So during that time, we can see this type of changes that are occurring in a wound. The last phase is maturation phase, which begins as early as after 3 weeks from the second stage, and it lasts up to a year. So in this stage, the maturation stage, so when we palpate, the scar tissues that are formed at the bed of the injury now has came up, they become more thinner, firmer, and inelastic while or on palpation. So these are the 3 stages that we can see on a wound healing. Now moving forward with the healing by intention. So there is basically 3 type of intention healing that occurs if a wound or an injury occurs. So it basically goes as primary, secondary, tertiary, or first, second, or third degree intention. Any of them can work. So over here in first intention, the wound edges are approximate and held in place, just as we see in the sutures, until healing occurs. So wound is easily closed and dead space is eliminated. So as we can see in the picture besides, in the primary intention, there is a clear incision that we can see on the first image. Then we need to suture it from inner layer, that is the epidermis, the inner layer, that is the dermis, and the upper layer, that is the epidermis. So both layer we need to suture it because it need to hold each other. That's how the healing will occur. Moving with the second intention, so in this, healing occurs with the injuries or wounds that have tissue loss and requires gradual filling in of the dead space with connective tissues. So in this type of intention, as we can see in the image besides in the secondary intention, first we can see the gapping irregular wound. So there is an irregular gapping wound. There is like the loss of tissue we can see. So we need to let it fill gradually with the tissues to just form the base, to fill the dead gap, right? To just fill with the tissue, and then it will fill with the connective tissues and the healing will occur. Now moving towards the third intention. So in this type of intention, it involves delayed primary closure and occurs with wounds that are intentionally left open for several days for irrigation or removal of debris and exudates. Once debris has been removed and inflammation resolves, the wound is closed by first intention. So in this tertiary intention, the image says that there is a wound. As you can see in the first step, there is a wound. Then we need to left it open to just intentionally the healing may occurs, right? To just let it heal intentionally for several days as the healing occurs, and it is left open. So it's left open to remove the debris and exudates that it forms from the lower layers, so we can remove it, right? So it is purposefully left open. And in the last stage, we will tie it up with the sutures after some of the healing has occurred. So in third degree intention, first we need to let the healing occurs by zone for several days without any treatment or without any manipulation, and the wound is kept open because we need to irrigate, we need to remove all the debris and exudates from it. And then after somewhat healing of the wound. The leftover we need to suture so it can close up properly with proper healing. So these are the three types of intention healing that we can see in hospital setting on an injured tissue. Now we will see the types of wound drainage. So we have seen the injury, how the wound healing occurs, how we can heal it. Now we will see what type of drainage a wound can produce, right? So there are several types of drainage. We will go one by one. So first is serous drainage. So in serous drainage, it is a clear or straw colored drainage which occurs as a normal part of healing process. So it's a clear straw color fluid or drainage that is produced from the wound or the injured part, which is a result of a normal part of healing process. Got it? The second type of drainage is the serosanguineous drainage. It's a pink colored drainage which occurs due to the presence of small amount of blood cells mixed with the serous drainage. It also occurs as a normal part of healing process. So it is also normal as the presence of some small amount of blood cells which mixes with the serous drainage, that is a clear and straw color fluid that occurs or produced from the injury, that both mixes and form the serosanguineous drainage. It is also normal as a part of healing. Then the third one is a sanguineous drainage. The first one is serous drainage, the second one is serosanguineous drainage, and the third one is sanguineous drainage. So it is red drainage from trauma to a blood vessels. Like if there is any injury occurred on the skin and that has damaged the blood vessels beneath, it will lead to sanguineous drainage. So it may occurs with the wound cleansing and other trauma to the wound. It's abnormal in the wound. It is not normal. It is abnormal, and it should be corrected as soon as possible to prevent the loss of blood. The fourth one is hemorrhaging. So it's a frank blood from a leaking blood vessel. It may require emergency treatment to control bleeding. It's an abnormal wound exudate. So hemorrhage, we all know that hemorrhage is not normal. So it's hemorrhage means it's a frank, fresh blood that is coming from the blood vessels, which occurs from the trauma to the blood vessels, right? So it should be treated with an emergency treatment to just control the bleeding, not to treat the wound but to just control the bleeding, because loss of blood can lead to many of the complications, right? So it is an abnormal kind of drainage, and that we need to treat immediately. And the last one is purulent. It is a yellow, gray, or green drainage due to infection in the wound. So while treating the injury or wound, not maintaining sterile technique can lead to acquiring the infection in the injury area or the wound area. So that can lead to purulent discharge. It is a yellow, gray, or green color discharge that we can see at the wound site. If you like this video, please like, comment, and subscribe to our YouTube channel, that is NCLEX-RN. And thank you for watching. Stay tuned for the new topics that we will cover in next video. Thank you so much. Bye bye.